So I'm Louise Mesher. I'm a vet. I've been a vet for, I don't know, going 16 and a half years now. I have a house call practice, at-home veterinary services. I have 2 other vets that work with us, several licensed techs, and our whole thing is really geriatric animals, dogs and cats. We do see young ones, but usually they are animals that come to us most of the time via we have sort of ushered their older animal through the end of life, and then we've sort of bonded with the owners, and then they get their new dog or their new kitten or whatever, and so can I put it in my pocket? Sorry, should have worn my looser pants. So I'm really glad that we went around and introduced everybody. That puts me a lot more at ease because I know I'm amongst my people. I can tell I'm amongst my people. And I think you would all agree with me that there is very little in this world that is as endearing and amazing as a little old cat. Like, oh. So I grew up with no cats. My mother was afraid of cats. I got my first cat at the age of 19, and she was a hellion cat, a kitten. But since then, I usually have 6 cats in my house, and it's strange. We keep saying we're going to let attrition take them down, and then what happens is somehow that void gets filled, right? Another one comes along. So right now, in April this year, we had 6 cats over the age of 10, from 10 to 17. I only have 4 left now. I lost 2 of my 15-year-olds, both to cancer. That's something we'll talk about a little bit. But anyway, I could go on forever and ever and ever about old cats, and I'm going to try to talk about things that might be of interest to you guys. And let me know if, at the end we'll have a big question-answer period, and I'll keep on answering questions as long as I can. But, just know this is something that I love, and I'm so glad that you guys cared enough about the old cats to come here to listen to me. I'm not a, professional speaker by any means, but it is an area that I like. So anyway, our practice, because we see a lot of old cats, we see a lot of cats actually in general that have been either booted out of other clinics, or the people have said, I am not taking my cat in because it might kill them. They won't get a good exam anyway, or it's just too traumatic and too stressful. And so we sort of have developed over time some real passion for, and we take it as a real accomplishment when we can see a cat like Daniela's cat and actually get the samples that we need, and nobody gets hurt, and the cat is okay, and that kind of thing. So anyway, today what I hope to do, where's my little clicker? I hope to talk about senior and geriatric cats for optimal quality of life. This is not about squeaking out every single minute with your cat if it's not good quality time. And I think that's where sometimes it can get a bit challenging, and it varies. We all have our own individual personal belief system about when you've gone too far. So this is not a talk on hospice. I did one of those last year. This is a talk on how to optimize how they're feeling at whatever age they are, and to maybe some ways to get around the fact that sometimes providing the medical care for these cats can be really challenging and stressful for the owner, stressful for the cat, and sometimes we back off from treating them because we're worried about the stress. So let's see. All right, so this is what I'm going to talk about, just a little bit about what aging is, a little bit about diet. Dr. Fletcher did a great talk a month ago, that Daniela said you can get online. There's a video at animalcommunity.org, which is the ACT website. A little bit on preventative care, and that's not vaccines. That's about preventing some of the older diseases or the age-related diseases that we see. Things that might prompt a vet visit, medicating your cat, common diseases and conditions, environmental modification and enrichments. I love that one. A little bit about a comfort kit, which is, it's not really a real thing. It's something I'm just sort of putting together, and then some conclusions. So seniors and did you guys all get the handout thing there? Yeah. Okay, and everything I'm going to say essentially of a substantive nature is in there. I call seniors anybody kind of 10 and up. And obviously you can have a cat that is 15 years old, and technically geriatric. I'd probably call geriatric anybody who was 14 to 17 or older. But some of those geriatric cats are in really great shape and are kind of more like seniors, or, you know what I'm saying there. Oh, those are my cats, aren't they cute? So piled on top of each other. I know. Those were in front of the fireplace. It got the dog bed, and the dog is never on it, and it's always the cats. So, as I mentioned, Dr. Fletcher made a beautiful presentation that I agree everything she said about canned cat food, and this is a place where my techs kind of have to kick me sometimes because it's sort of a bit of a soapbox thing for me. I feel like dry food, the pet food industry has done a bit of a disservice, or a big disservice, to cats. And there was, for years and years, the dry food companies would sort of say the dry food is good for the cat's teeth, and so that's why everyone jumped on that. Plus, it's convenient. Let's face it, dry food, way more convenient. But from the cat's perspective, it's not the ideal food. And Dr. Fletcher talked a lot about that, and it's about the composition, it's about the water, it's about the less grain, the higher protein, the lower carbohydrates. Those are all things. Think about the cat's natural diet, what it would be. It would be mice and birds, right? And for years I've been saying I'm going to start a mouse food factory. Like to make it. Wouldn't it be the greatest thing? Seriously, except I can't quite, get my head around the logistics of any of that and the sort of the ethics of it. But really, if I could open a can and have ground mouse, that would be perfect. So the canned food thing it's huge, and it can be hard to get your cat to eat canned food. I'll talk a little bit about that. But it's important enough, especially for old cats, because of the water and because it's not full of grain that can lead to constipation. I mean, constipation is a huge problem in these old cats, and we'll talk a little more in depth about that. One thing I put up here, there's a lot more stuff in the handout, but your cat must eat and eat enough calories, and this is just my opportunity to say, as important as the canned food is, you never want to get yourself in a battle of wills with the cat about, are you going to eat this canned food or not, because I'm not going to give you anything else. You can't do it like that. It's, a dog, you might withhold 24 hours of food if you were really, really desperate for a diet change. You can't do that for a cat. I mean, you just can't. They have to eat. And the other thing to remember is that canned food is very, for volume, quarter cup of canned food, quarter cup of dry food, vastly different in the amount of calories that they have. So even though you think, he only eats a third of a cup of dry food a day, you can't just give them a third of a cup of canned food. It's just not as calorie dense. So I think probably most of you guys are experienced enough to know that if a cat doesn't eat, you can end up with hepatic lipidosis, liver disease that is a bit of a challenge to treat. It can be successfully treated, but it's a bit of a challenge, and we'd rather prevent that. So just make sure that is happening. Tricks to get your cat interested in food. That is referring to, and I think I probably mentioned it here, Dr. Fletcher would have mentioned, and I think I probably put it in the handout here, there's a veterinarian, I think she's in California, Dr. Pearson, who has a really beautiful, amazing website called catinfo.org, and it has every bit of information you would ever want on feeding cats, right down to, if you are going to make your own cat food, how do you do it? How do you transition? How do you, and the document I'm really referring to is the one called, I think, Tips to Transition a Dry Food Addict Cat onto cat food or canned food. And so it has a bunch of really good things, and so I would say look at that if you haven't already, because sometimes that's sort of the biggest holdout is, okay, sure, we all know it, but how do we do it? And I would say do it gradually. Try any kind of cat food. This is not the time, especially with an old cat, to just stand on principle and say you have to have cat food that is $3 a can. This is the time to say, all right, you're not going to eat the $3 a can, then okay, here's your Friskies. And I'm not opposed to a lot of those cheaper cat foods. I think it's pretty much better for any cat to be eating, and I'm not talking about cats that have a specific medical problem, right, that precludes them from eating XYZ food, but just in general, pretty much any canned food is better. So I would say it's worth pursuing, but don't feel like it has to be the highest end food. And as Danielle and I were talking about, a lot of times when you're making the transition to canned food, you'll throw a lot of canned food away, and you just kind of have to. And Dr. Lisa Pearson says you have to accept it. Accept the fact you're going to throw a lot of canned food away, and know that gradually, and sometimes it's tricks like warm it up. Add a little bit of warm chicken broth. Add a little bit of flaked tuna on the top. She mentions Parmesan cheese, grating that on the top. Some cats are very dairy motivated, others not so much. Appetite stimulants, there's a whole list of them here. Mirtazapine, one thing I would say about mirtazapine, you guys have probably all seen mirtazapine around, right, and used it. It used to be that we prescribed it as something that you gave every 72 hours. That was the way we first started using it. Now, although most of the time you would never see this, it's not on any label, but we use it often at a lower dose every day for some of these old cats. And I actually, the vet who works with me, she just got back from the holistic conference, and one of the vets there was using cyproheptadine, which has been around for even longer. Anybody who works in a shelter probably has seen cyproheptadine at some point in their life, right? And that was one that usually we were giving twice a day, tablet form. And then sort of mirtazapine came in and kind of bumped it out of favor. This holistic conference, there was somebody there who was using it in a transdermal form, which I thought was really interesting. So we just scripted it out the other day for somebody, so we'll see how that works. She's been on it for about a week, and she's eaten okay so far, but it's hard to tell, is it that, is it something else? Acupuncture, I do acupuncture. One of my favorite uses for acupuncture is appetite stimulation. It actually is, it's pretty good, especially if it's due to a disease that is gastrointestinal, like sometimes pancreatitis, that kind of thing. And I've been shocked, and I'll talk a little bit about acupuncture later. I've been shocked at how well cats tolerate acupuncture. It's amazing to me. It's really kind of cool, actually, to see them really just relax into that. Prednisolone, you've probably all heard sort of the no old cat should die without the benefit of prednisolone thing. There are some situations where you've got an 18-year-old cat who is really on their last legs, that the other things don't work, and you say, all right, let's go. Let's try this prednisolone, and a lot of times they'll have a little uptick in how they feel, and it's fraught with all kinds of problems, but you sort of just have to go into it knowing what might happen. Feeding tube temporarily, that is something I think a lot of people sort of dig their feet into, and I'm not talking about keeping your 20-year-old cat alive who won't eat by putting it on a feeding tube and just keeping it going like that. I'm talking about a cat who has, chronic kidney disease, and all of a sudden they have a real, an acute flare-up where they really need to be hospitalized, or you're treating them at home with fluids, a lot of fluids, and if you could just get them past that bump, and their kidney values are starting to come down, they're doing a little better, but they're still not eating. Sometimes you can put an esophageal feeding tube in, and it's easy to put in. It's not, they're under anesthesia for 5 minutes. I mean, it's really easy, and sometimes that can get you over the hump so that you're back to, okay, now he's eating again. And I've seen that happen. The thing is, we all have a bit of a stigma about feeding tubes. I just wanted to say that keep an open mind, because sometimes there are cases where that can be the thing that bridges them on into, all right, now they got another couple years of good time. Because you know how cat is, when they stop eating, a lot of times you try all these things and you just know when you just have to get them eating, and once they're eating a little bit, then they'll take off and they'll keep eating, right? I'm not a fan of syringe feeding, force feeding. It sort of doesn't feel right to me, and I think it does create a lot of food aversions. A lot of times they'll be like, I'm not eating anything of that texture ever again. All right. Uh-oh. Now what did I do? Oh, I turned my thing around. Okay. Preventative care. I would say usually every year for a cat, sort of a senior cat, twice a year for anybody over 14, and I have quite a few patients who I see every 3 months, every 4 months, depending on what they have going on them. Why people do not seek veterinary care, it's really obvious. You guys know why people don't. There's nothing worse than trying to get a cat into a carrier that doesn't want to go into a carrier. So what I have written here, my favorite drug that has changed our practice is gabapentin. Any of you guys use gabapentin in this way? Yeah, and it is, so it's a human drug for seizures. We use it in low dose for cats, and what we do is have people will actually, with cats that are challenging, like Daniela's cat, we will script them out just a couple of capsules. The people will break the capsules and mix the powder into some canned food or baby food or whatever, about 2 to 3 hours before we get there, and it's a total game changer. Those cats are just, they are so much better. So however bad your cat is, it'll be a lot better. It doesn't mean you will get to the point where you don't need any kind of injectable sedation, but there's a good chance that you won't.
That actually that's just kind of an anti-anxiety?
It works as a sedative, but yet they're still able to walk. They're still interactive. They'll still eat. It's a beautiful thing. I had one of, I don't treat my own cats because I'm not very good at treating my own cats. A lot of us, I think, are not great at restraining our own cats. So I have one of my friends, one of the vets who works with me, come, and I had all 4 of my cats gabapentin before she came because it just, she was able to draw blood. She was able to, really, really get a good feel of their belly, and it's safe. It is not something that's going to hurt their kidneys or their liver. What it is, I would say in heart disease, I think it should be a little caution should be used and maybe use a lot lower dose. Because with one of my own cats who has a heart murmur, it kind of just has a little bit more of a profound effect when they have heart disease. So other than that, I would say it is a very, very safe. And so a lot of times what we have people do, because we don't do any dentals or any anesthetic procedures, right? But we have to get those cats who have specifically been seeking house call veterinary care. We have to get them into a clinic to get their dentals done. So the people are like, we're not putting the cat. Sometimes we'll have our technicians go out and actually put them in the carrier for them. But usually what we do is prescribe the gabapentin, and then the people do that. They put it in just a teeny tiny bit, because these cats are supposed to be fasted, right? In a tablespoon, and then it makes getting them into the carrier easy. It makes the trip way less stressful, and then it makes whichever veterinarian is doing the dental be able to examine them and, easily. Getting your cat into a carrier, this group probably doesn't need a lot of talk about that. Like what I do is usually pick them up, walk them into a room where it's sitting on its end, open, right? Like that. And that's, you have to be fast, and you have to hold their hind feet, and that kind of thing. You can't try to push a cat. Sometimes I see the owners trying to push their cat face first into the carrier. It's like, okay. Although I do have one of my cats will just do that, but and then choose a vet clinic that takes extra steps. Not every vet loves to work with cats, and that's just the thing. I mean, some vets don't like to work with dogs. So kind of try to feel out. I mean, it's not just, I'm not saying you have to go to a feline-only practice by any means. There are lots of vets in dog and cat practices who love working with cats. Just sort of know if you get that feeling like, wow, that could have been a lot more peaceful than that, or a little less stressful than that. You can seek out, there's a fear-free movement now, fear-free practice movement out, and there's also cat-friendly practices. And some people have sort of gone through some training and trained their staff to try to make it a little better. But okay, let's see. All right, weight loss or sudden gain. This is often the most sensitive indicator, and if you guys have old cats and you don't have a baby scale, you should get a baby scale or access to a baby scale, and I just tell people to just weigh them once a month. I mean, it's you can get them cheap. The ones that are veterinary specific are often way more expensive. I mean, in the vet catalogs, they'll be $250. Amazon, the same things, $45. So get a scale. Changes in water consumption. You've all seen those cats who are drinking a ton. It's almost always drinking more as opposed to drinking less. Vomiting, changes in stool, changes in appetite, grooming, habit. That's a big one. Cats are creatures of habit, and when they start hanging out in the back of a closet or behind a piece of furniture that they have never spent time in before, that is a red flag for sure. Changes in behavior, I'm referring there to, the cat who used to be docile but is now all of a sudden aggressive. that I went to a talk recently, and one of the best pain people in the country, she was saying pretty much every aggressive cat, I don't know if I believe her, but pretty much every aggressive cat has some pain somewhere. And I think some are just, just maybe not all of them, but I do see that, and I think cats, and we'll talk about pain a little bit later, about changes in motility. Okay, unusual odors. Don't think that just, my cat's getting old, he smells like an old cat. They should smell exactly the same as they did when they're younger, right? If their smell is off, then there's something wrong. Vocalizations, the nighttime vocalizations, changes in elimination habits, and something just isn't right. You guys know them, you know your cats, the owners know their cats, and it's to be listened for. Okay, the difficult to medicate cat. I know, I love that picture, isn't that awesome? And some of this was sort of alluded to earlier when you're talking about the compounding of gabapentin. We use Northwest compounders. Most of the time we're practically next door to them down there, and they mail out prescriptions all the time. We rarely use a medication that has not been compounded because we can almost always get them into a form that is better. One thing I would say, there's tiny tabs, alternatives to oral. So many of my clients, I show them how to do subcutaneous injections. I have them give their medications by sub-Q injections because for most cats, it's easier to give a sub-Q injection than to pill them. Right? And but not everything can be given by sub-Q, and that's the thing. And so that's when you get into hiding medication. And I have listed some things there. I mean, you get creative. Anchovy paste, cream cheese. Don't use the full pill pocket. The cat pill pocket, even though it's a lot smaller than the dog ones, just take off a little piece. And I usually do use the, here's one that's empty, here's one with the pill, here's another one that's empty kind of thing. But I had one of my own cats for 2 years. He was hyperthyroid. I gave him methimazole tablets in a blob of cream cheese, and he would come looking for it. So be creative. Anything that they're carnivores. Anything in the dairy, the meat, the fish, unless they have known allergies, that's what you should try. Pill pockets, yes. These little gel caps, have you guys seen those? Yeah. I mean, and they're especially good for ones that are quarter tablets, because cats are small. We often use quarter tablets or half tablets, and they have that raw edge, which tastes really bad. So the size you want is at least 4, 5 is even smaller. And if you can, I usually will take them and cut them and make them even smaller so that they form just a little encapsulation around there, and then you can put that in a pill pocket or put that in cream cheese, and then if they do happen to roll it out of the stuff, then it doesn't taste bad. Pill guns or poppers. I put in there, Dr. McGeorge at the cat clinic, she's got a real nifty little thing that she sells there. She's essentially cut the end off a syringe, and she puts canned food in, puts the pill in, puts more canned food in, and then gives it like a pill gun kind of thing, but it's wrapped in, because if you use a regular pill gun, you can't put food in there and get it to come out nicely. So, and then ask for instruction. I have a really good client who, for a long time, she didn't give her cat its medication because when I found out what she was trying to do, she was holding it like a baby, and then with her other hand trying to, put it in like that, and nobody had showed her how to give a pill, and I think that sort of highlights that we all work in the animal field. We have a much greater level of skill with this, and it's not always obvious. So to your clients, make sure you show them how to pill a cat, and I'm sure there are YouTube videos that'll do that. What's going on now? I'm having trouble. Hit timeout. There we go. Okay. So a little bit more about injectable medications and fluids. Subcutaneous fluids, warm them up. Probably a lot of you do that anyway. I like to put them in a bowl of hot water. I think I wrote in the thing a little informal test. I'm such a geek. I'm at home, like with my little laser gun thing that detects the temperature, and I'm checking the temperature of the water in the bag, and then the water as it comes out of the fluid line, for the sub-Q fluids to see. Yeah, total geek. So, this is a Friday night or something, and I'm like, here to my husband, here, hold this bag while I do this. But anyway, 7 degrees is what it lost, because one of the other vets and I have a little thing where she's like, nah, don't bother warming them. I'm like, oh, you gotta warm them. So anyway, 7 degrees, and I think that's enough. I mean, body temperature is 100-ish, right? And room temperature is 70. Those are cold going under them. Different gauge needle, different brand. Some of them, Terumo has an ultra-thin wall, one that's supposed to flow a lot faster, so you can use a smaller gauge and it flows through. And I actually haven't used them. I haven't had that, but I have had people who have said that. Associated reward. And then this skin button thing, isn't that the coolest little thing? You can see what that is? This is new. This is a little device that gets implanted easily with local anesthetic under the skin, the back where you always put sub-Q fluids for cats. And you just make a little incision. So I would probably I'm going to actually contacted the rep because they are brand new, and she's going to send me a few, so I'm going to put them in 3 of my old cats to just try them out. But what it's going to allow you to do is put your needle in through this center part, and it stays in there. And so for those cats that are really sensitive to the poke of the needle, and you'll be able to give injections and fluid through that little thing. And so when you talk to the rep, and when I was at that conference recently, there was a critical care specialist. She was there. She did a lab on it, so we all got to, put them in. And she said she had been using them, and she had some animals that she had them in for a couple of months, and other animals that she had to replace them after 3 or 4 weeks. And I would say for most cases, 3 or 4 weeks, it's not worth doing it, right? But and I think it's early enough on that they are sort of figuring out how long, how to work out the kinks with that. And so that's why I wanted to put it in 3 of my cats, so that I could see how long could I do it. Because if I could do it for 4 months and then change it, for some of these cats, that would be life-saving. But
what's the ballpark cost?
I would guess it'll probably cost, when we are putting them in, and we'll do it in people's houses, it will probably be about $150, I would say. It really should only take 10 to 15 minutes to put in. The little thing itself is not cheap.
And is the hair shaved around there so you can find it?
Yeah. You shave a little spot. I mean, the hair is going to grow back. The critical care person who did the lab at the conference, she had actually a dog, a big dog, who was getting 1 liter of fluids a day sub-Q for kidney failure, and it was a young dog. And it was owned by some older people who just couldn't do it. So this was the only way that this dog was able to. And so she, would change it every 3 months or whatever. And so that, in that way, it's really awesome. I don't think that all the kinks are worked out in some way.
How long has it been around, and have you done it yet?
No, I placed one at the lab.
Oh, okay.
It's brand new. Yeah, brand new, like within the last few months. So I've been wanting something like this for a long time. They used to have other ports that had a lot of problems with them as far as infection and that kind of thing. Yeah, and I think these ones don't have a lot of problems with infection. I think what they have is the potential that they scar tissue forms around them. So, I mean, that's the thing. But it has a lot of promise and could really change, especially for some of these hospice animals that I see. I mean, they're 18 years old, and you know how thin their skin gets, and they're at home with people who just can't bear the thought of hurting them. So, yeah, I think that's an up-and-coming thing that you'll hear more about, but is not like you're probably not going to be able to go to your vet now and say, I want a skin button, and they'll say, here you go. That's an up-and-coming kind of thing. Injectable medication at home, let your veterinarian know that you are willing to learn. I think that's a lot of things. A lot of times vets don't realize the people want to do this. It's easier for them. They want to do it. And sometimes we'll have people put, there's that little port. We'll just have them give some of the medication in the line, the IV fluid line. So, all right, diseases. All right, hyperthyroidism. So what I can't do, because you saw all the diseases that I want to talk about, I can't get into the laboratory changes and everything that are in for all of these diseases. But what I hope to do is just talk a little bit about treatment options and things that might make things easier as far as treating them in a really practical sense. So things that you might have heard of, and I can always answer questions afterwards. I love this picture. I just found this on the internet today. See him eating that big thing of... you guys have all probably seen hyperthyroid cats, right? I read a stat the other day that said that 10% of cats will become hyperthyroid. And nobody really knows why. They're suspecting it has something to do with goiterogenic, because it's a tumor, most of the time a benign tumor on the thyroid gland, that there are some chemicals perhaps in the lining of the cans, something in the environment that is causing this, but it's a dramatic increase from what it used to be years ago. And so everybody will come across some of these cats. Methimazole, this is one of the few medications that we really do know that it is absorbed transdermally, so rubbing it on the ears does work for this one. Hill's YD food. Has anyone used Hill's YD food? What were your thoughts?
It didn't work.
It didn't work?
No. We had to go back to that.
I've never used it. I've never prescribed it. What's that? No, 2-3 years maybe. So it's an iodine-restricted food because without the iodine, the extra hormone cannot be made. And the thing is, it has to be fed exclusively. So in a multi-cat household, it gets dicey, right?
Yeah.
Any time you're trying to feed cats, multiple cats, different diets, it's dicey. And so it gets really dicey with that one. I also think it's a highly processed food, right? And most people are giving it in a dry form. So I'm going to leave it at that. It's not my go-to for sure. Radioactive iodine treatment. So I was telling you I had one cat that gets methimazole in a blob of cream cheese. Another one that I have of my own, I had 2 hyperthyroid at the same time. I took her up to Tacoma and had the radioactive iodine treatment, which fixed it. I mean, it's quite an amazing thing. This is something I want to spend a tiny bit more time on, hypertension, because it's so underdiagnosed. It is an epidemic out there that nobody is, I can't say nobody, but a lot of people don't realize it's a real problem. And a lot of times cats who have hyperthyroidism, kidney disease, heart disease, those cats are at risk of high blood pressure. The problem is the symptoms are vague. Sometimes you don't see anything until you see blindness. And that it's always sad. The good news is, I think the stat is like 65%, the ophthalmologist told me 65% of the cats, if you get them quickly after they have become blind from hypertension, will regain their vision. So you just have to be sort of vigilant. This comment about note the variation in machines and operators, this is a real problem. Part of the problem is measuring it after a trip into the vet. They almost all come out too high. So having it done at home, if you can get a technician to come and do it, a lot of times that'll be a little more accurate. It also varies from machine to machine. I had a fancy digital machine that I actually sold because it didn't seem to be as reliable as my old thing that looks like it came from like the Cold War. You know what I'm talking about, right? The Doppler. And operators too. I mean, it's always best if you've got a problem with hypertension, to have the same person, if you can, check it again, because the technique may be a little bit off. And the other thing is, just know that for some cats, if you have to, even though they may be at risk of high blood pressure, if you have to really sedate them in order to handle them, to get the cuffs on to do it, then you're probably not going to have a real accurate reading. Anyway, all right, here's the big one. Kidney disease, renal insufficiency. I like to try to call it insufficiency instead, because failure always sounds really awful. Everybody's seen cats with kidney disease, I'm sure, right? Usually they're older, but not always. Sometimes you'll see a young one. PUPD, that I think I probably had on another one. Just if anybody doesn't know, that's polyuria, polydipsia, which means too much drinking, too much peeing. Sometimes inappropriate urination is because they don't have the strength to get to the litter pan as many times as they need to go every day. And a lot of the behavior problems particularly with inappropriate urination, are due to medical things. And I would say that certainly any older cat who suddenly starts peeing outside the litter pan needs to be checked for kidney disease. The comments there, check for urinary tract infection and hypertension. Hypertension you see very commonly, high blood pressure with kidney disease, and urinary tract infection. I can't tell you how many of those are undiagnosed. That is you just have to, we actually set up a little culture incubator at our practice so that we can do them cheaply, kind of a yes-no. Is there an infection? Yes or no? Because they're expensive. I mean, they're usually $120, something like that, to get it. But any cat that has dilute urine has a much higher risk of having a urinary tract infection, and it can make things worse. It also can, it can dehydrate them. It feels miserable. So make sure that, I would say yearly, any cat that has kidney disease should, when they get their sort of annual blood work or their biannual blood work or whatever, should have a culture along with that, if at all possible. Prescription diet controversy, I've written that there. That's the thing about the diets. I mean, many of us, when you think of what do you feed a cat with kidney disease, you think, all right, we've got to get them on a low-protein diet, right? That's for years we've been told. There's Hill's KD, there's Purina NF. And I think that there are sort of starting to be two camps of vets out there. There are the vets that think, no, these are carnivores who are supposed to be eating meat, and we can't restrict their protein too early. If you restrict their protein really early, then they start losing muscle mass. And that is, if you were to go on our Veterinary Information Network, our forum for vets, it's just a constant thing. You get some specialists say, get them on KD really early on in the disease, and then other people, and we tend to fall into the other people group who say, most importantly, that they eat. Next, most importantly, that it be canned. Next, most importantly, that if it is canned and they have kidney disease, that you try to reduce the phosphorus. And usually what we'll do is have them put a phosphate binder in the food. So, I mean, it's a huge topic, it's a huge problem, but just know that there are a lot of vets out there that are saying, no, we don't want the protein restriction this early. We want to wait until the very, very, very end. And even then, I would argue, if you can sort of modify it, or most importantly, keeping them eating, because a lot of times the prescription diets are not palatable. They don't like them. You can try. We actually have, so the only things that we sell prescription diets for at our clinic, it's not really a clinic, is stones. It's a place where really it can do wonderful things, right? Bladder stones. And a few select cases. I have a little dog of my own now on a UD. for portosystemic shunt, but we actually keep, for the people, our clients that want to have their cat on a prescription diet, if they are sort of that, we keep the 3 major brands, and we'll make a little sample pack, and we'll say, here you go, here's your 3, 1 can of each to see. So there's Purina NF, Hills, and there's a Royal Canin, low protein too, and say here, see which, and most of the time they say they won't eat any of them. I'm like, okay, get your fancy feast, and here's some phosphate binder, right? Because most importantly, I mean, you know that you have to keep them eating, right? You have to keep them eating. So prescription diets have their place. You just have to, have a critical mind about it and an open mind about there might be another way. Standard and less common treatments, what was I getting at there? That's where the phosphate binders and things like anti-nausea medication and famotidine and that kind of thing come in. I mean, people use those as supportive roles, essentially treating the symptoms of kidney disease. The less common ones I was referring to, there is a Chinese herb that I've prescribed, that Rehmannia 8, which is really supposed to do amazing things with kidney disease. I haven't used it long enough to say that I've seen the amazingness of it all. And I would say, again, I would pull it away from any animal who, if it changed their eating, their appetite, it's just not worth it to give them anything that's going to have them stop eating. It's called Rehmannia 8. It's in the notes.
Oh, it is great.
Yeah. And mostly for that, you're going to need to get someone who does acupuncture or certified in Chinese herbs, that kind of thing. And then acupuncture. Acupuncture is pretty good for kidney disease too, both because it can help their appetite, but also the thought is that it's bringing some oomph to the kidneys themselves. All right. Diabetes. This is my cat, my diabetic. I have like one of each of these things, right? His name is Q. We have a Star Trek contingent at our house. PUPD, almost always increased appetite, almost always. They don't always lose weight. He's 19 pounds. He's always been 19 pounds, and he's been diabetic for about 5 years now. Sometimes they're lethargic. A lot of times you won't notice it until it's really far. Inappropriate urination, that's a good one. Diet is really, really important. This is, to my shame, this is one that I feel like I caused him to be diabetic because I had multiple cats, and I had one cat who had fiber-responsive diarrhea, and I think that the excess of the fiber and the higher carbohydrates of that tipped him over into it, and I have not been able to get him into remission, but I have lots of clients who can get their cats into remission with a diet change, a good diet change and insulin. It's definitely doable. Concurrent urinary tract infections, huge, and dental infections, huge. Those are the 2 main types of infections, I would say, that can cause cats to become resistant to their insulin and not be well controlled. So if you have a cat that is really having a hard time getting controlled, that would be the kind of thing that I would culture their urine, have somebody look in their mouth. Home monitoring. How many of you guys have done home glucose testing? Yeah. On your own cats, on some of your clients? Client.
I'm young. They haven't done it. The others
And
yet.
some cats are easy and some aren't, right? I mean, that's just like anything. This is Coco. She has cancer. She is a lovely cat with a really weird type of cancer in her kidneys. And for her, even though if kidney transplantation was a possibility, she could have it. It's not, because it's elsewhere in her body. We've chosen to do, palliative care therapy for her, and she's quite comfortable right now. But my main point with this was saying what you can do for one cat, you can't do for every cat. And you have to pick and choose your treatments based on the cat that you have. And she actually is doing surprisingly well with her treatments, but she's getting fluids, an appetite stimulant. She's the one who gets the transdermal cyproheptadine. She's getting fluids. She gets pain, two kinds of pain medication, and anti-nausea medication. She was on antibiotics for a while, but anyway, she's doing just great. So this cat is actually the brother of Coco, and his name is Tommy. This kitty taught a lot of people a lot of stuff about cats. He died recently, sadly, but he had a really bad heart disease and kidney disease, and you may all know that the heart with heart disease wants no fluids. They would prefer that the cat be in a state of dehydration all the time. The kidneys want lots of fluids, and the two are really not very compatible. But he did really great for way longer than he was anticipated to, and I'll talk a little bit about him when we get to the comfort kit, emergency kit kind of thing. Constipation. This is something I think that we could all intervene earlier on constipation, and just noticing sort of at what point the stool is getting dry and hard and those little pebbles at that point before you even think they're constipated. That's when stool softeners, Miralax, pumpkin, that kind of thing, or they may need subcutaneous fluids. Let's see. Make the litter pan attractive. I like that. Well, we'll talk about the attractive litter pan coming up here. Periodontal disease, we all know that it can have huge side effects or ramifications throughout the rest of the body. And then I put a little thing here about the risks of anesthesia and the pros and cons of doing it in an old dog. What happens to me all the time is I'll say to somebody, your 14-year-old cat really needs to have his teeth done. And I sort of say it apologetically. They need to have their teeth done. And people are like, he's so old, I don't want to put him under anesthesia. And I say, I completely understand that. And I'm not saying that it's right for you, but I would urge you to think, in 1 year, when you have an abscessed tooth and it has to happen and your cat is 1 or 2 years older then, how much easier is it going to be under anesthesia then? And a lot of people sort of think about it and they're like, yep, you're right, I might as well do it. And I say, if you do it now, this will be the last anesthetic procedure your cat will ever need. And now it's different when you get up to 18-year-old cat, 19-year-old cat. Then, maybe the cons outweigh the pros, but it's an individual situation. But I would just say, just because your cat's 15 doesn't mean they should not have their teeth cleaned. So pancreatitis, that one is really hard to diagnose, underdiagnosed again. Abdominal pain, I think, is the biggest thing, which can be really hard for an owner to assess in a cat. And sometimes it's just a vague, they're not eating that well, and they're hiding in the corner. That's it. And it can sometimes take a little while to get to that diagnosis, but it is common, and it can be an acute flare-up. It can linger for months and months and months. I have some patients who are on the Serenia every day and have been for months, and that is what keeps the inflammation down. And yeah, inflammatory bowel disease. The only thing I really wanted to say about inflammatory bowel disease is that it can be distinguishing it from lymphoma and pancreatitis can be really difficult, even with biopsy. And sometimes the biopsy will say it's inflammatory bowel disease, and a year later, clearly it's not just inflammatory bowel disease. I've written here prednisolone. This is where it's often used, both as an appetite stimulant as an anti-inflammatory. It can be given transdermally, although it's not one that I think the absorption is as rock solid. Injectable prednisolone acetate, that's something that is given under the skin. You have to usually get it from a compounder. That's for the ones that will not take it in any other way. But honestly, most cats on prednisolone are eating so much anyway, you can hide it in baby food or whatever. Avoid Depo-Medrol if at all possible. There are the occasional situation you've got a caregiver who is, unable to medicate their cat at all, that sometimes it can be useful, but fecal transplants in the future, I had to put that up there. It's the wave of the future. You guys will all hear me say that said, some point in the future, fecal transplants. Fecal transplants, they actually, and my vet colleague who went to that holistic conference said, and they're doing it in people too. They're taking flora from healthy people and putting it into sick people because the microbiology or the microbes that are in the flora are often responsible for so much of your health. So, and so they are actually transplanting, and at some point in the future, you'll see, 5 years, we'll be doing it all the time. Diet change, vitamin B12, that's another injection thing that you guys can all be doing. And I would say pretty much any cat that's not eating well long-term should be on vitamin B12. It's really safe. Slippery elm, that's a holistic thing that actually works pretty well. Change in grooming may mean there's a medical problem. Matting, you've all seen the cats with the mats along the back. I think a lot of that is arthritis. They just can't reach it anymore. They're not as flexible. Sanitary trim. Oh, ingrown nails. You know how those old cats get those really thick nails? Those are the ones that you really just have to make sure the person knows they have to be trimmed, because that's a painful thing to expect them to walk around on that. The flea thing, just because they're old and they're indoor only. I've seen fleas in cats on the 5th story in a loft in the Pearl. I mean, indoor only cats, they can do anything. Cognitive decline. He does not have cognitive decline. I would just like to say he is, however, 15, and isn't he gorgeous? No grooming problems. Yes, that's Spencer. And so this selegiline here, Anapril, I've used that a couple times with sort of variable effect. I think the big thing is, when I was preparing for this, I was researching sort of what are people saying is the latest, greatest thing for cats who are going senile. Coconut oil, I know in dogs, is thought the medium chain triglycerides is supposed to be really helpful in old dogs, like 5 grams a day or something is what you're supposed to be giving dogs. I would suggest that you work up to that level, or else you may have some diarrhea. But this new cat senior, those are senior vitamins, antioxidants. Some of those really antioxidants in general can be helpful. I think it's one of those things that because we don't always know what is causing them to have the cognitive decline. So to say, supplementing one thing or another may not necessarily hit the problem. But just see all these things up here: deafness, blindness, hypertension, dehydration, pain. All of those things, people think sometimes that their animal is going senile, and it's actually, high blood pressure. That's probably the most common one, high blood pressure, or they're actually blind or deaf, and people don't realize it. All right, if this is inappropriate elimination, if it's a new problem in an old cat, think medical rather than behavioral first. In a younger cat, I would say it's probably the opposite. But an older cat, a lot of times is that. So this Association of Feline Practitioners has a really nice, kind of lengthy algorithm on how to sort out the what to do with a cat who's peeing or pooping outside the box, and where to go from there. Make sure the litter pan is accessible and attractive. Again, I'll talk a little bit more about that. And pain is one of the most common, I would say the most common reason they stop using the litter pan. I mean, one thing is they're trying to tell you something. They're trying to tell you, I'm constipated, I am dehydrated, there's something wrong, I have, abdominal pain. But back pain, way underdiagnosed in cats. Hip pain, arthritis, abdominal pain, that'll do it. And a lot of times, sometimes you'll hear people say that the cat will take the front feet will be in the box and the hind end will be out. They just don't want to go up over the top. All right, so this is my favorite topic. So I'm like way past time, Daniela. Is everybody okay? All right. Am I talking about stuff that's like helpful?
If people need to leave,
They'll leave.
feel bad doing that, and this will be on video later. So.
Okay. All right. So there was some stat recently saying that something like, I've forgotten it, I went looking for it, I couldn't find it, but 90% of cats over the age of 10, have radiographic changes of arthritis. It is way underdiagnosed. Before I became a house call vet, I confess that I was probably missing 90% of cats with arthritis because cats don't walk in a clinic, right? They don't. You bring them in, you put them on the thing, and they're either like this or, and they just don't do it. But when I started going to people's houses, I'm like, holy crap, this cat is really painful. But the people have just seen it as a slow progression. They haven't seen it as, they just think, oh, he's just getting old, right? Well, yes, he is getting old, but he's also getting really painful. Reluctance to jump on the bed or furniture, and they say, oh, he used to sleep with me, but he doesn't anymore. Hiding, aggression, over-grooming, limiting outside the litter pan. Bone cancers you occasionally see. My point there being that you don't necessarily have to have radiographs to treat arthritis, and you certainly don't need to have radiographs to treat pain. But do know that there are some sort of outlier cases where, it may be more than just arthritis. All right. This is my cat, another one of my cats. This is the hyperthyroid cat with the cream cheese, and he also had arthritis. Can you see the little acupuncture needle there? He loved his acupuncture. Loved it. You could just, he's sort of zoned out there. You don't even have to restrain them most of the time. They just, once you get the needles in, they just. Cosequin, that's sort of one that's been around for a long time. Those capsules you can put in their food. Fish oil. I would say for most cases, this is a very early on thing. For most cases, it's not enough. It's not going to directly, take pain away. The NSAID controversy. So the NSAIDs, for anybody who doesn't know, it's a non-steroidal anti-inflammatory drug. That meloxicam, Onsior, and the meloxicam has a checkered past. It used to be that, and you all know the dogs that are on arthritis medication, and for a little while we started using them in cats. And then there was a study that came out that said that at the label dose on the meloxicam, that they were at high risk of kidney failure from it. And so then the FDA came out with a black box warning printed right on there saying, if you use this in cats, be aware that it could be very dangerous. And so everyone stopped using them. I stopped using it for like 4 years. And then over the last year or two, there's been more research coming out saying that, in Canada and in Europe, they've been using this drug at a dose that's about 10 times less than what's on our label here in this country. And they've been using it just fine and safely and well. So a couple of studies recently have said in large populations they've been using it, and they've even used it in cats that have kidney disease, like pre-existing kidney disease, and that in some of those cats they actually seemed to live longer. And I don't know if there's speculation, is it because it's somehow reduces the inflammation in the kidney, or is it because they feel better and they get up and walk to the water bowl more? I don't know, and I don't think anybody knows. But I do think, so we've started using it in cats at a really low dose. We talk to the people, we tell them all the risks, but for some of these cats, it is the single biggest thing that makes them move, walk, feel comfortable. And a lot of them need to have more than one thing, right? So a lot of animals that have arthritis are on way more than one medication for arthritis. And meloxicam is kind of nice because it's a liquid that doesn't seem to be too objectionable, and the volume that we use is usually like 0.1 to 0.2 of a mil. Every day, it's sort of a honey flavored. I tasted it; it's not that bad. You can just put it in their food, and most cats will eat it. But it's not. This is one of those things that when you go to your vet, half of them at least will say, "Oh, you don't use meloxicam in cats," and the other half will say, "Yeah, I heard some people are starting to use it again." And then you'll get a small percentage that say, "Yeah, we're using it, but at really low doses." Onsior is a tablet form, and it is labeled for post-operative thing for 3 days, I think. You would have to pill it, but I think in the future you'll see that in probably a liquid form that everyone's given every day too, but it's not yet. Everyone here in this room is probably given transmucosal buprenorphine, right, to cats. Works very well. The thing I want to point out here is that whether or not it's compounded or whether or not it's the injectable that is given to them, you really do want to have the contact with the gums. It's not going to work if you mix it with the food and then they eat it, because it's just the way it is absorbed and the way it's not absorbed from the stomach. It's not going to work. So it just has to have just a couple seconds contact in the mouth. And then gabapentin, as we talked about earlier, a lot of cats on that, and yes, compounded into something that tastes good. I have one cat who eats it every day, loves it in honey. Not pure honey, honey-flavored stuff. Adequin, I don't know if you guys, have you used Adequin in cats at all? Anybody? Yeah, it's pretty nice. It works really well in the right cases. If it's an injectable thing, it's easier for the owners. I just teach the owners how to give it. They give it usually once a week, but it's not going to help for pain that is not due to arthritis. Acupuncture, weight loss. Look at that little cat. I wish I knew him, but I don't. He's not mine. And then, so therapeutic laser, really good for back pain. Again, you have to weigh the stress of taking them into a clinic for that, if that's, and some cats it's fine, but all right. So this is the cat earlier, Spencer. This is his friend, Orange Boy. This is a catio. The catio that's as big as this room, and it's one of my clients has this amazing setup, and look how happy he is. He's like almost 16 years old, and he loves it out there in the sun. That's one of the things that I love about house calls is I get to see all these creative things that people have done. I mean, some of the catios are very simple, and some are just palatial. Heated beds, snuggle safe. This heated bed actually came from that cat Coco with the cancer. Her mom bought her 3 of them, and she only really wants to sleep in the one in her office, so she gave us the extra one or 2. The stairs up to the owner's bed or couch, because I think we'd all agree that trying to keep them in their normal habits, if they've always slept with you, then that's what you want. They want to do that for the rest of their life, right? So the stairs, and sometimes they won't use the stairs. Sometimes they just are like, not doing it. All right, litter pans. We all probably have heard 1 per cat plus 1. That's what they say, magic number. And big and low. That is the key, and I have a couple pictures after. For years, the litter pans have been, way too small. A lot of these cats, they just don't have the flexibility, right, to turn as well, and yeah. So the low, this is the single biggest thing that anybody with an inappropriate urination cat, who's an old cat, can do is get a litter pan that has a low entry, and a lot of those will be improved. Waterproof mat, that's for those ones that put the front feet in and stay out. This is another thing, a little sort of soapbox for me. This litter pan on every floor can't tell you how many houses I've gone in, and they've got a 19-year-old cat, and they have a litter pen in the basement,
Yeah.
right?
Oh, yeah.
And the cat can hardly walk, and they're expected, and they've got kidney failure, so they need to pee 18 times a day, and they're supposed to go down the stairs, and
Put it in the nastiest corner of the basement.
oh,
Yeah.
I know, and
Can't get that.
right. So I like to say you should have one on every floor. Even if you don't have an arthritic cat, it's kind of nice if you could have one on every floor, but that doesn't always work. But for an arthritic old cat, whew, every floor for sure. And scoop daily to see the changes so that you can see when the poop looks like a little marble. And then, have you guys seen this color changing litter? Pretty Litter Cats. It's up for pre-order now. That it actually, it's not coming out till December, but it will change several bright colors when there's blood or oh God, I can't remember what the other things are that it's checking for, but it's worth looking at. It's kind of neat because I think it will give early warning for a lot of people. Yeah. And then this hydrophobic sand for urine collection. How many of you guys have tried to collect urine with Nosorb? You know, those little plastic pellets. Cats hate that stuff, right? Sometimes you'll get lucky, but this stuff looks just like sand, and when they pee, it just stays on the top, and you can just take a pipette and just suck it off, and none of the things come with it. It's amazing. Yeah, it's really cool. We just ordered some of that in too, just to try. So, my pictures. How did I not notice that I put that on there upside down? So this captures, you know, Coco and Tommy, those two cats that I showed you earlier. This encapsulates my life. This is where I visit, and this is my litter pen, the dark cave. But I put that up there to show you that all I did there was take a giant thing, and I just cut the end out. Now, if I had cats that had a hard time getting the litter pen, I would just cut it down lower and put less sand in there. But the high sides are nice, right? My cats would never handle this because the sides are too low. And that's actually a litter pan too, that fancy thing. Isn't that funny? But that's how you make it attractive. And of course, we probably all have heard from most cats, they've done studies, and most cats prefer the sandy stuff to the larger pellet type things or to the recycled newspaper or whatever. So I would say that's the first thing to do if you have, once you've eliminated pain or medical problems, if you have somebody who's peeing outside the litter pan and you've fixed the size of the threshold, you probably want to change and see if they like a different kind of litter better. All right, we're nearing the end. So this is a comfort kit, and what I'm referring to there is if you have a good relationship with your vet and you can say, okay, you know my cat has this disease and this disease, and what happens if something happens in the middle of the night? As much as I love Dove Lewis and I'm glad they're here, I know that most of my clients do not want to take the cat here at 3 a.m., right? So if you have an 18-year-old cat that is prone to pancreatitis and vomiting and that kind of thing, having an injection or two, even just 1 or 2 injections of narcotic pain medication, if they can show you how to give it, injectable anti-nausea medication, fluids, have a little, I am prepared for that middle of the night thing. That cat Tommy, the one with the kidney failure and the heart disease, he had an oxygen tank at home. I gave him an oxygen tank she kept in her closet and some injectable diuretics and some pain medication in the middle of the night, can't breathe, got to calm things down. How do I deal with this scenario? I don't want to take them in because the trip into the vet with a cat that can't breathe is very dangerous. So that's where I would say just talking to the vets about what might we have on hand that could help. Now, I have the caveat up here that in some cases, if you think that the animal needs it, you might be actually missing the opportunity for a vet to, do something different or fix something different. But I think you know what I'm talking about, right? The real old cat who you just are feeling like we're at the near the end of the road here, and I just need to make them more comfortable until my vet is open tomorrow morning, and then I can talk to them about what to do, that kind of thing. So a lot of vets will happily, I would say, give you some of these precautionary tools. And, all right, so it's not what can be done, it's about what should be done. And someone said that to me a long time ago, and I try not to forget it, because we can always do more. It doesn't mean it's what we should do, right? And weigh the stress to your cat, and just know that there are often, you might think, oh, it's too hard, can't be done, too much. There often are things that can be done. I hope that was clear, like with the gabapentin and that kind of thing, that a lot of creative problem solving. Preserve your relationship and bond, and try to enjoy them, because as we all know, every single minute with these little old cats is precious.